Need advice? Download the free Hello Doctor app on any mobile phone and connect with our doctors right away for reliable personal advice. Go to hellodoctor.com and chat to a doctor anytime, anywhere for less than the cost of an apple a day.
You could search for health advice online and get general information. Or you could request a house call from Hello Doctor and get personal advice from a real doctor. I know what I would choose. So let's unpack this week's most interesting house call setting.
A missed period is usually the first sign, and only one, that you might be pregnant. So it's no surprise that the first thing that pops into your mind when you miss your period is that you could be pregnant.
Oh yeah. I mean, obviously if you're trying for a baby, it's something you've been waiting for, but if not, it can be quite a stressful and worrying time.
No, of course. And that's what happened to our caller this week. Her name is Palisa. She called this week and she'd missed her period for 2 months. Her immediate reaction was to check if she was pregnant. After 4 tests and 4 negative results, she was convinced she wasn't, but she did want to understand what the problem could be.
I can imagine so. Presumably she had been having regular periods up until that point.
Yes, she had. And she actually has what we call in medicine secondary amenorrhea.
Okay, well, besides pregnancy, there are a lot of other factors that can result in a missed period. Women who stop birth control, for example, may experience changes in their cycles. It can take as long as 3 months for their bodies to acclimatize. Breastfeeding can also impact your cycle. In fact, we know that she wasn't pregnant, but she was taking, or was she taking any kind of birth control or breastfeeding?
No, she's not breastfeeding, and she hasn't been pregnant ever before. And she hasn't changed her method of contraception for over a year or so.
Okay, good to have eliminated those. I guess at 32 it'd be unlikely that Palisa would be experiencing menopause. So some of the other more common possibilities would be extreme stress, extreme weight loss, or weight gain in fact, over-exercising, polycystic ovarian syndrome, and thyroid disorders.
I asked her whether she went regularly to a gynae for an annual checkup and her pap smear, and she said she did. She had been diagnosed with the precancerous cells from a previous HPV infection, so she never missed an appointment.
Good for her. Any history of hormonal conditions, illnesses?
No, she's never been diagnosed with any hormonal problems or would suggest any polycystic ovaries or an issue with her thyroid. Actually, her GP had done a thyroid blood test recently on her because her hair had been falling out a lot more than usual. But those came back as normal.
Fascinating. What about her weight? Was this stable? I mean, both being overweight and underweight can put some heavy pressure on your internal organs.
Well, she has never had any problems with weight in the past. And she tries to eat as well as she can, and she tries to run most days of the week.
I'm very impressed. Although excessive exercise is a well-known cause of amenorrhea, missing a period. We know that exercise has tremendous health benefits, of course, but moderation is equally important. An unhealthy amount of physical stress forces your body to protect itself, and preventing ovulation is one of the body's protective reactions.
Now, of course, that's very true. Well, my first thought when I started speaking to her was ask about her lifestyle. And it emerged that there was a whole host of other things that were happening in her life, all of which were causing her distress. She was also struggling to get in her regular run. And I found that besides the usual being busy, she had just moved to a new house. She had a new job, plus she is planning a wedding.
I mean, anyone who's gone through any of those things knows how stressful it can be. I can only imagine trying to cope with all 3 at once. In fact, after pregnancy, emotional stress is the second most common cause of late or missed periods, more especially in teenagers. I mean, emotional anxiety can negatively affect the hypothalamus, the part of the brain that regulates hormones, that in turn affects ovulation, which results in an interrupted menstrual cycle. I guess in Palisa's case, stress is possibly the cause of a hair loss too.
I recommend that Palisa make an appointment with a gynae just to make sure that nothing else was amiss. And then I suggested a few stress management options for her to try. In most cases, once the key stressor is removed, things get back to normal pretty quickly. I'm certain this will be true for Palisa as well.
Man, I hope so. Thankfully, you didn't have to pull your hair out over this one. Good advice, Doc. Good advice.
Need advice? Download the free Hello Doctor app on any mobile phone and connect with our doctors right away for reliable personal advice. Go to hellodoctor.com and chat to a doctor anytime, anywhere for less than the cost of an apple a day.